laba jeerna loo geystay xadgudub dumareed.
Akaanza kunichapa na nilikuwa sijawahi kupigwa.
Gender-based violence is some form of violence meted to men, women, boys and girls, rape, sexual assault. We've heard of domestic violence. You read in the papers, you hear from people that gender violence is an issue in this country.
The discourse in the public space has definitely changed. Working with media, working with service providers, working with the government, launching annual campaigns that make sure that the issue is on the public's agenda.
As a government, for the first time, we are here to acclaim our women and their dignity. But let us not forget that none of that shall happen unless you and me, as individuals, decide to take responsibility.
We work on these programs at the national and at the county levels. At the national level, we do more of advocacy so that issues of gender-based violence are supported and if possible, resources are provided. At the same time, we build the capacity of particularly the government so that they will be able to coordinate and oversee the implementation of the gender-based violence program in Kenya. And we have done that with the Gender Directorate now, where we provide resources to the Gender Directorate, which is under the Ministry of Devolution and Planning, so that they can develop some national documents, for example, the national policy on GBV.
Part of our programs include urban migrant health. We recognize that Eastleigh hosts migrants from Somalia. In terms of implementation of activities on the ground, we have an implementing partner, Matibabu Foundation.
International Organization for Migrants, they are our funding partners. And besides from funding, they normally support us with trainings for the community health workers and for the healthcare workers within the district.
As a community health worker, we are the linkage between the facility and the community. We act as referrals, identifying cases. We have what we call household visits that is done every Tuesday, covering within the area of Eastleigh.
maya cabsi ma gelin waa la dhiirigeliyay waxa la daawooyinka waan kugu caawin karnaa lacagna kaama rabno xanuunkaagana waan la soconaynaa.
I referred Fatima here first because she had a diabetic case, but recently she came with a different case of rape.
laba jeerna loo geystay xadgudub dumareed. mar waan qariyay ma sheegan markaan isbitaal la diray. waxaan aad u fiican oo aan dhihi lahaa dumarkaas inay ka hadlaan dhibaatooyinkooda sababtoo qofkaas hadlan lama ogaanayo dhibka uu qabo inuu dhibkiisa sheegto la daaweeyo daawo ay helaan la caawiyo aad ay wanaagsan tahay.
So for sexual and gender-based violence, we've been collaborating with the Ministry of Health and the World Health Organization to train healthcare workers from hotspot counties where sexual and gender-based violence are prevalent. Our plan is like going forward in the future to scale up the trainings because we feel like what we've done is just a drop in the sea.
UNFP has worked in Naivasha for many years and worked with the different implementing partners. We have the Ministry of Health, the NGOs, we have the CBOs who come together for the purposes of making sure that they coordinate their work.
Welcome to the River Refuge Center. We deal with girls, women, boys, and we also deal with men. Hello, Joy. The major aims of the center is to try to prevent, to reduce, and also to let people be sensitized about the issues of SGBV.
We began the center from 2010. We came to understand that so many women are single. When they approach us, they tell us about their past life.
Nilipopata nyumba yangu, yani nilioleka, tukashinda vizuri, tukakaa vizuri. Sasa tukafika mahali mzee wangu akashika grupu yenye hayuhusikani. Sasa hatukuwa tunaelewana kwa hiyo akaanza kunichapa na nilikuwa sijawahi kupigwa. Nikaanza sasa kuchuana na mama Agnes. Nilipomwelezea shida zangu, naye akakuwa na advice. Naona sasa mama akikuja tunaongea, alafu sasa anasema Lydia unaendeleaje, na ninamwambia hapo mbele, na sasa ninaona kuna tofauti.
We have many rescue centers where we can take these survivors to, because they require a lot of psychosocial support, a lot of counseling, so that continuous management can be done there.
Emily is a health worker. She's been giving us her expertise and she's been really helping us in terms of getting to also give counseling.
We want to do a lot of male involvement through education, because we know when men are involved and they understand these things, and they can assist us in preventing the sexual violence.
Deep within us, we feel that we've had what we needed to start something and also to create a change that we needed to create in our society. The journey has already begun.
I think the future is going to incorporate a lot from what we've learned, build on the foundations that we have set up.
Working together as different agencies towards a common goal.
Partnership between various organizations has been advantageous to us because it has helped us to bring more impact.
We haven't done enough to engage the men, and I'm happy that we have what we call the he for she.
We have certain challenges that must be looked into. We have the Sexual Offences Act. It is not being implemented. And so as women parliamentarians, we've said we must push for more budgetary allocation in the security docket to ensure that the women of this country, the girl child of this country, the boy child of this country is protected from violence, Mr. President.
With political will, we can be able to get the resources, we can be able to implement the program, and be able to get everybody on board.
We have seen a change. The government is investing in response services to GBV. That's a kind of impact this program can quite confidently point to having been a part of.